February is Heart Disease Awareness Month, and it's an opportunity to get those reminders on how to take care of your heart. And we have the experts here today to talk about that. Dr. Ahmood Amritpillay, a cardiologist from USA Health, is here to help us with what we can do, because we know heart disease has a lot to do with your genes, but there are some steps you can take to prevent it. Talk to us about that.
That is definitely true. So let me go over what are a few things that put someone's at risk for heart disease. So there are some factors that we call non-modifiable, like someone's age, their gender, some ladies beyond the menopause, or someone's family history, as you mentioned. These are non-modifiable risk factors. But there are certain other things that you can actually identify and mitigate them. So a few things like that include, for example, what is your cholesterol number? How high are your sugars running? What is your blood pressure doing? And if you have other risk factors like, do you smoke? If you smoke, how much do you smoke? Do you take excessive amounts of alcohol? What is your limit, like activity level? So these are things that you need to find out, because that will tell you what is your risk of developing heart disease going forward.
Right. You know, we reported on an alarming statistic just yesterday from the Alabama Department of Public Health that heart disease deaths, Alabama leads in the nation. And one of the reasons why they pointed to was a lack of primary care physicians.
That is definitely very true. So as I was mentioning, the modifiable risk factors, the few things that you can find out about the cholesterol, about your blood pressure, about your sugars, these are very common things that you can find if you go to your primary care doctor or your cardiologist, whichever one you choose. So I would say the first thing a person can do is make an appointment with either the cardiologist or their primary care doctor and get themselves evaluated for these things. We can tailor-made the plan for a person depending on what their risk factors are. That's the one biggest thing you can do. Second biggest thing, if someone is smoking, they really need to stop smoking, not decrease it, not down to 1 cigarette, 0 cigarettes, 0 smoke. Even passive smoking is bad. So, and it's a team effort. It's a whole family has to come around, help the person get out of that addiction. And we, again, if you go to the primary care office or our cardiology offices, we can help you with that. And the third thing I would say is increase your activity level.
That is the funnest part, actually, for me at least. And speaking of activity levels, you know, the heart walk comes along. That's one way you can do that. And those events also help to raise money for research, like what's being funded right now, artificial intelligence. Can you talk about that? That is so
true. Yeah, absolutely. So nowadays we live in this era of very strong computers. We have very strong computing powers, and we have newer algorithms and softwares to our disposal. We also have data points of millions and millions of patients that we can use to identify unfound associations between diseases. Like if a person was to go for any surgery or is going through any procedure, we can tell who are the people who are at higher risk of developing a bad outcome after the procedure, or God forbid, die after a procedure. So we can find out based on these artificial intelligence algorithms that who is at a higher risk as compared to other people. Those people we can take extra effort, extra steps, maybe see them in the clinic soon after their procedure or their surgery. So this is just one example, but this can go beyond different arenas and different subspecialties.
Well, I certainly appreciate you stopping by to share this information.
Thank you so much. Thank you so much for having me here.
Absolutely. We're going to have this interview posted on our YouTube page shortly after this newscast. Subscribe, and that way you'll be notified when we upload a new video there. Thank you.
Thank you so much.